Okay. Good morning, everyone, and thank you all for tuning in for today's discussion. I'm Congresswoman Lori Trahan. I'm thrilled to be joined by a group of individuals who have worked diligently and tirelessly to address the addiction crisis facing our community, our Commonwealth, and our country. As many of you know, today is Overdose Awareness Day, an important reminder of how far we still have to go to destigmatize addiction, combat the opioid crisis, and break down barriers to treatment here in Massachusetts. The crisis has affected almost every single family in Massachusetts one way or another, and far too many families have an empty seat at the table today because they lost a loved one, because their addiction either went undiagnosed or untreated. When I first got to Congress 5 years ago, addiction wasn't an issue a lot of people were talking about, and it certainly wasn't the focus of large bipartisan bills to get folks the help that they desperately need. But thanks to the tireless efforts of the panelists here today and the bipartisan working group on addiction that I'm a proud member of, times are finally changing. In fact, since the last time we hosted one of these live discussions, the president has signed my Medication Access and Training Expansion Act, also known as the MAID Act, into law. This bipartisan legislation standardized substance use disorder training to ensure that all prescribers of addictive medications have a baseline knowledge in evidence-based addiction prevention and treatment. I've also worked with the president over the years to designate this whole week as Overdose Awareness Week to remember all those we have lost too soon and to push to end the devastating addiction crisis. Finally, I want to mention that we're having this conversation as Congress is set to reauthorize the SUPPORT Act, critically important legislation that promotes opioid use disorder treatment and recovery. And I'll be sure to bring the takeaways from this conversation to that reauthorization process in Washington happening in just a few short weeks. But today, our focus is on the work that's being done on the ground here in Massachusetts to help those battling addiction. And I couldn't be more excited to be joined by three pioneers who are really spearheading the charge to change how we approach the addiction crisis so that we can get help to folks before it's too late. So first, I'd like to introduce Sheriff Peter Katusian. He is joining us from the road today as he moves his son into college. And for that, we are extremely grateful for his participation and his dedication to this conversation. As a law enforcement leader, prosecutor, legislator, and professor, Sheriff Katusian has worked on the intricate issues that intersect public safety and public health throughout his career. He's a graduate of Bridgewater State University, the New England School of Law, and Harvard University's Kennedy School of Government. During his time as a state representative, Sheriff Katusian oversaw Massachusetts healthcare priorities as chairman of the Committee on Public Health, and he led the state's first commissions on prescription drug abuse, as well as ethnic disparities in healthcare. As sheriff of Middlesex County, his use of specialty units to target treatment towards unique populations such as young adults and military veterans has earned national acclaim. More importantly, his commitment to data-driven research has made these programs and their results, reduced recidivism and healthier, safer communities, replicable across the country. And finally, I've had the honor of working with him to stand up the Middlesex County Restoration Center Commission, which will create greater opportunities to divert individuals in behavioral health crises away from jails and emergency rooms and to immediate treatment. I'm proud to have secured more than $1.6 million to support this center, and I look forward to our continued work together to make sure the program is a resounding success and made contagious across the Commonwealth and the country. Welcome, Sheriff Katusian.
Congresswoman, thank you. It's great to be here with you.
Terrific. And thank you so much for doing this from the road on such an important day for you and your family. Next, I have the pleasure of introducing Dr. Sarah Bagley, an associate professor of medicine and pediatrics at Boston University School of Medicine. She is board certified in pediatrics, internal medicine and addiction medicine, and is the founder of The Catalyst at Boston Medical Center, providing integrative substance use care and primary care for youth where she sees patients. Dr. Bagley's research focus is on the engagement of young adults who use drugs and their families in care to minimize the risk of overdose and the complications of drug use. She has impressively secured funding from National Institute on Drug Abuse, the Centers for Disease Control and Prevention, and Patient-Centered Outcomes Research Institute to support her research. And we're incredibly fortunate to have her here with us this morning. Welcome, Dr. Bagley.
Thanks so much for having me, Congresswoman. Glad to be here.
Great. And last but certainly not least, I'm thrilled to have Miata Eddie Osagi from Marlboro Hills Rehab and Healthcare Center joining us for this discussion. Miata is an experienced licensed healthcare administrator, had served as a skilled nursing facility administrator for the past 12 years, working for some of the largest long-term care providers in New England. After earning a Master's of Science in Healthcare Administration from the University of Maryland, UC, Miata began her long-term care career as a long-term care ombudsman in the state of Massachusetts and as a volunteer as a nursing home patient and resident advocate. Her advocacy on behalf of the elderly and infirmed remains the cornerstone of her role as a nursing home administrator. Miata has experienced multiple changes and shifts in the long-term care industry, and these changes have now evolved into providers like Miata having to care for individuals suffering from substance use disorders and accompanying behavioral health issues. Miata, welcome to the conversation.
Thank you for having me. It's a pleasure being here.
So as you can see, we have a whole host of knowledge and expertise with us today, which means I'm going to stop talking and start asking the experts the questions that we all have on our mind. And I want to make sure that we give these phenomenal guests as much time to speak as possible. So let's jump right into our questions. And this one's for everyone. I'll start off by acknowledging the very serious challenges that we've had when it comes to addiction crisis post-pandemic. Now, some of this has been well documented and some of it just hasn't. So I'd like to open it up to you all to talk about what trends you're seeing in addiction since the COVID-19 pandemic. And Sheriff Katusian, if you want to take that first, and then we'll just go around in the same order, that would be great.
Thank you, Lori. And it's great to be with you and such a distinguished panel. You did mention that my son is moving in for his first day. It's my second son. And it is an emotional day, but quite honestly, I'm excited because I can see that he's ready for this, right? I'm excited for his future. So it's really for those parents that have had someone go to school, just knowing they're ready and they're excited about it and it will transform their lives is a really wonderful feeling. And Lori, thank you for your leadership on this issue. People should really understand that the Congresswoman has led on this issue. And I think it's really important, not just with the MATE legislation, but also the Middlesex County Restoration Center, with your funding being crucial in its development, but also remembering, that the trends are troubling. 160,000 people, died in 2021 of illicit drugs and opioid prescription pills. But I think, Congresswoman, you said it best. It's that seat that's empty around the table, right? That breaks my heart when I think about that. It's really important that we always remember this is about the people, not just a policy issue. The real problem now has been that COVID was a public health epidemic, but it was layered on top of two already terrible epidemics that we were having, and that's, substance use disorder and mental health. So it really just laid over on top of two other problematic issues in our health system. And this is especially true for the people that are entering my facility that already come in with significant behavioral health needs. And I just got some numbers this morning, so I want to cite them so people can understand the population that we see that are incarcerated. And by the way, the numbers in Middlesex will be no different than anywhere in the country. Over 50% have a diagnosed substance use disorder when they enter my facility. Now, since 2019, that's a 74% increase, right? Diagnosed mental illness, 61%. That's a 133% increase since 2019. Open mental health cases. Right now, we're hitting 79% of our people inside have an open mental health case. And some of that can be for very serious things, but some of it can also be for anxieties and sleep disorders and things like that. But we're attending to 80% of our population with our mental health staff. And then the co-occurring substance use along with the mental illness is 92%. Now, I'm sure Sarah and Miata can always remember the days when those numbers were bad, but they were never this bad, right? They're much worse than ever before. So even though, the number, our overall number has decreased in our facility during COVID and afterwards, the acuity level of the population we serve has increased significantly, and the difficulty of treating those that we serve is also much more significant. So I always say vision without good data is just a hallucination, that you've got to collect your data to know where you're going. Otherwise, we're just flying blind, and we think we know where we're going, but oftentimes we cannot know where we're going. So we collect a lot of data in our shop, and we run a Matador program, medication-assisted treatment and opioid recovery program, which has become a national model. We offer all three forms of medication-assisted treatment, and it has had remarkable results. All three forms, we've treated almost over 1,200 patients in the last 4 years. 25% of them are actually new to medication-assisted treatment. They're the first time. And the unique window that we have to break that cycle of addiction, and really almost more than addiction, but death, is a great opportunity for us in a place of incarceration. People that are released from a place of incarceration are 120 times more likely to die as a result of an overdose. So we have them at a very vulnerable point. We have a greater responsibility as we turn them back out. That's why, in addition to the medication, we provide counseling and post-release services. This is a practice that I took from my public health days and my healthcare days in the State House as well. And then we work with them to provide Narcan kits with PARI on their way out. Now, if you've seen the results of this work, we check all of our names with the medical examiner's office to see if anyone died as a result of an overdose in our facility, or if they died, and then if it was as a result of an overdose. And the latest numbers are that 97% of our participants in our program did not suffer a fatal overdose within 1 year of release, which is pretty remarkable. Our studies have also shown that we've extended time for those that did die until their death over the norm. And so that's another opportunity to continue to save those lives. So I just think there's an incredible window of opportunity that we have. But I will say this, and I'll say it again and again, I'm proud of the programs we have and the opportunities for treatment we have in the Middlesex Jail and Sheriff's and House of Corrections. But you shouldn't have to come to jail to get good treatment and program. You should be able to get it out in the community. And I think that's something that Sarah and Miata will also speak a little bit more about as well.
Thank you, Sheriff. Similar, same question, Dr. Bagley, we'll go to you next around trends that you're seeing post-COVID-19.
All right. I think thanks so much for this question. And I think too, just sort of asking about sort of the nuance of like sort of what is known, and then maybe what are some of the things that we are starting to see clinically. So I work with adolescents and young adults primarily. And so sort of what are we seeing and what are we hearing from youth and from their families? And I think, one thing I just want to emphasize, and just the acuity of the mental health crisis is really intense. And I think that sort of so important that sort of as we think about the overdose crisis and the people that we have lost in Massachusetts, the patients, the people, involved with my family, like there's such pain, and the mental health crisis is so closely intertwined, and that have really seen how rates of depression and anxiety and trauma that people experience that may predispose them to substance use disorder, but then once they have a substance use disorder or have substance use, have new and ongoing trauma, is like a really important driver. And so thinking about approaches that sort of really take sort of the whole person and everything that is going on in their lives that might be contributing to their substance use into consideration is so critical as we continue to really advocate for increased access to low barrier medications for opioid use disorder and increased access for naloxone in communities, which is also obviously like critical and life-saving. So again, so the acuity of the mental health crisis, I think too, just the evolving this didn't happen necessarily because of the pandemic, but sort of the evolving drug supply and the sort of dynamic drug supply that we are all sort of contending with as well. And so I imagine a lot of people have heard that there's this new drug called xylazine, which is this tranquilizer and is not responsive to naloxone, although is often with opioids. So you should always use naloxone. The message is like, it's always use naloxone, always still be calling 911. But it really has complicated sort of rescues and is leading to sort of complications related to infections that I think are really hard for the individuals who we take care of. And I think we're going to continue to see that drug supply evolve. So I think as we notice these trends, trying to think about building systems that can be responsive to a changing drug supply, so that we continue to educate the public about the risks, and then also different ways that we may need to respond. I wanted to note too, I think another thing we've seen though is some more flexibility in how we're able to offer care. And I think we're going to have different opportunities to talk about that this morning, but we have more flexibility in how we're able to invite people into treatment with us and offer medications like buprenorphine and methadone. And that's been really exciting. And we hear that from our patients, and there's really nice data to also show how important that's been. And finally, I do think like we're starting to see like Narcan is more available. More people do know about naloxone and know about overdose prevention. And so I think all of the important work that has happened, and Massachusetts has been such a leader in doing this work, I think is starting to make a difference sort of on the community level as well.
Well, thank you for that. I mean, you certainly mentioned a lot of trends, both, frightening and then opportunities that, we maybe didn't know about if we hadn't lived, through COVID in terms of innovative models of care. So I look forward to double clicking on that with you. But before we do, Miata, would love to hear your perspective.
So I first want to start by thanking you and echoing Sheriff Katuja and Dr. Bagley by saying thank you for highlighting this really critical public health issue that we're seeing in the healthcare sector in our community. So in the long-term care and skilled nursing facility setting, we're seeing that as a number of older adults with chronic medical illnesses and substance use disorders, especially opioid use disorders, increases, so does the need for post-acute care services in skilled nursing facilities. We're also seeing that in addition to the growing number of older adults having these substance use disorders, we're also seeing individuals below the age of 65 needing our skilled nursing services with comorbidities associated with substance use disorders and opioid use disorders. Unfortunately, the care delivery within the skilled nursing facilities is not set up to match the needs of this growing number of individuals, both young and old, with substance use disorders. This unfortunately is due in part to societal, regulatory, financial, and educational barriers that exist within our sector of the healthcare continuum. Specifically, speaking specifically about the skilled nursing and long-term care setting. So many facilities in Massachusetts and across the nation really lack the capacity and resources required to care for these individuals suffering from substance use disorders. And in our facility, specifically Marlboro Hills, we are tasked with caring for individuals that as I mentioned, other facilities don't really have the capacity to care for. And we have additional challenges that we have to navigate with regards to, the sheriff mentioned, lack of community resources, right? That allows for safe transitions back to the community post-nursing facility care. So these are the trends that we're seeing in our industry. And thank you for highlighting this critical need. And hopefully with your attention and others, we'll be able to move the needle towards better care for these individuals.
And that is the goal. The issues that you all surface give us sort of the blueprint or the opportunity to, fix them, whether it's legislatively, whether it's through collaborations, within our community. But certainly, you all play such a major role in your day-to-day jobs, but also sort of thinking strategically about the future. So appreciate you being here. Again, this one is for you, Sheriff. I was hoping you can share what you've seen work in Lowell, communities across Middlesex County. What tools do law enforcement need to address this crisis, and how do we build on the progress that you've made with the Middlesex County Restoration Center to shift the approach to opioid use disorder to a health issue as opposed to a criminal one?
So one thing that I've really started to develop a little bit further when I speak to organizations is the idea that, we speak about the social determinants of health, right? But if you actually put those in a line and you compare them to the social determinants of justice involvement, they're identical factors, right? So they're always the same things that show the weaknesses in society and who are suffering from those weaknesses. As I said before, I'm proud of the programming and treatment we provide, but yet I really am proud. I don't think you'll find any better in the country, but you shouldn't have to come to jail to get this. You should be able to get into the community. And part of that is what you're leading with, Congresswoman, is to get these resources into the community. And so like the Middlesex Restoration Center, which will be a place that will serve not just not just people, the community, but also law enforcement and the hospitals, because people in crisis can go directly to the Restoration Center for their substance use or their mental health needs when they're in crisis. Yeah. All too often, when police are responding to a situation, the only tool in their tool belt is to walk away, which can be a very unsafe and unproductive way to handle what can be a dangerous situation, or bring them to the hospital. And then they have to stay with that individual. And in Lowell, the boarding times in the backup in the emergency room is incredible at Lowell General. And so they really suffer for this. So the answer is, the Restoration Center will be, people need a person to see, a place to go, and they need help. And that's what the Restoration Center will bring when we get it to that point. It'll be a 24/7 diversion facility. Again, it could be drop off, but it can also be people can walk in on their own. It won't be run by law enforcement organization. I'm the co-chair of this commission with Dana Mosh, who is the executive director of the Mass Association for Mental Health. So it's really driven more by her with supports by me and others on the commission. And it's really behavioral health and law enforcement experts coming together to address the ongoing problems and needs in our communities as well. So this is a physical space that is not a jail. It's not an emergency room. It's a place where people can go when they are in crisis, and where officers can safely drop off someone that's in crisis, or people can walk in with someone that's in crisis. Yeah. And quite honestly, it could be that hospitals can bring some that can be better served at this place than in their emergency room, so they can treat everyone else that has other medical emergencies in a more equitable and expeditious fashion, right? Yeah. We're also doing something called the Behavioral Health Justice Initiative, which is taking those with co-occurring substance use and behavioral health needs, and then assigning a navigator. What we found was our medication-assisted treatment program, using a navigator with lived experience, was one of the best ways, and I think Miata kind of really gets this too, is the best ways to steer people properly, because no one understands what they're going through more than someone that has been walking in their shoes before. But let me just tell you, the latest numbers on these, this provides both in-reach and outreach. So what happens is we connect with the individual inside while they're in our custody, build that relationship at that time when it's most important, and then we carry that relationship to the outside when it is the most beneficial to them. But it's important, the in-reach and then the outreach. The results have been very promising. After 6 months, the number of individuals owning or renting a residence increased from 14 to 29%, more than double, pretty incredible. Individuals who are employed increased from 36 to 45%, about a third, pretty incredible. And so we're trying to address the health-related social needs. Sometimes you just got to know where your next meal is coming from, or where you're going to lay your head that evening. And I think that these types of programs with the in-reach and the outreach and those supports turn the idea that the social network that so often brings people back into trouble, back into justice involvement, back into jail, can be turned on its head by providing positive social network supports that can say, I know what you're going through. How are you doing today? How can I be of help? And that can be sometimes the only positive contact in their lives at that time, the only one they can rely upon them to give good advice. This is why this in-reach and outreach is so important in these things. And the models that you have supported, Laurie, are so crucially important.
Well, I appreciate that, Sheriff. But you raised so many good points in that, there's nobody who's feeling sort of the real world impact of, substance use disorder, addiction, than our law enforcement, our ED docs and nurses and staff, because they are, the boarding times are just so much longer than ever before. So we really are looking forward to this Middlesex County Restoration Center becoming a national model. And we know that you're going to collect the data to make that case, but also the recovery coaches that you're talking about. I mean, those are relationships that we know work in the journey. And it's so great to see you talk about in-reach and outreach. You're giving me some new vocabulary to use too, because it's become such a crucial aspect for recovery. So my bill, the MAID Act, it was signed into law at the end of last year. It aims to give clinicians the tools necessary to identify a patient who's suffering from substance use disorder while breaking down the stigma of receiving treatment, right? You can't treat something that you don't have a conversation or an understanding about. And I'm wondering, and this is for Dr. Bagley and Miata, and also you, Sheriff, but what areas of stigma continue to persist? And how can we address the stigma that exists even in the medical and in the law enforcement communities?
Do you want me to? I'm happy to start.
Yes, please.
So thank you so much for your leadership for that on the MAID Act, and it's so crucial, because when I think about stigma, there are a couple of places that I think are important to start. One is that it's sort of this multifaceted or multi-level approach where you're thinking about, you need policy change or legislative changes, and then sort of the continuum to sort of being on the ground, working in communities and having individual conversations with family members to sort of break down stigma and answer questions and dispel myths and sort of have safe spaces to do that. So I sort of think about that continuum being so important. And then I think the other thing that is always sort of worth talking about when we're thinking about stigma is the stigma related to substance use disorder, and also the stigma related to actually the medications that we use to treat substance use disorder, because both exist. And especially the stigma related to medications can be a real barrier to people with opioid use disorder accessing this life-saving medication, because there are a lot of misconceptions, or families are concerned, or I work with kids, like agencies who are involved in their lives may have sort of concerns, and a lot of them end up sort of when it boils down to it, feels it's stigma that's underlying a lot of those barriers. So I think that education is key. I think sort of as we think about training sort of our medical, not just but sort of in addition to our medical providers, sort of thinking about social workers, other behavioral health folks who are in law enforcement, teachers, sort of really making sure everyone has access to appropriate education, sort of based on the interactions they're going to be having with different youth or adults or family members, so that they truly sort of understand what substance use is, what substance use disorder is, and have spaces to be able to answer those questions. I think leadership, like what you're doing, like leadership is so important. And so sort of having models of people and sort of being able to look at people who are able to use non-stigmatizing language and talk about this in a way that sort of changes norms over time, which definitely takes time, but it is so crucial. And then I do think sort of opportunities, I have really come as a researcher who even sometimes thinks about big data, these opportunities to have one-on-one conversations in communities is just so important, because I think that sometimes often there's a lot of fear, or the stigma is a barrier to asking questions. And so there's so much isolation, both for people who have substance use disorder and their families. And so really being able to create the spaces for people to talk open and honestly, answer questions from people who have lived experience or who work in the field is just also, I think, critical. And then you see sort of hearts and minds changing and evolving over time, but we have to like lead with compassion and understanding and curiosity, I think, in order to be able to truly address this.
Absolutely. I agree with Dr. Bagley 1,000%. Sheriff Katujian made a really salient point whereby he highlighted the importance of the relationships with individuals with lived experiences as part of the care continuum, right? They understand what substance use disorder is, right? How it impacts an individual's life. In order for us to remove that stigma, we have to continue to highlight the importance of those individuals with the lived experiences and allow them to be fully part of the care continuum for individuals with substance use disorders. Education, right? We need to change the societal perspective or perception of substance use disorders. And for folks outside of this group, right? The sheriff, myself, Dr. Bagley, and you, Congresswoman, the society needs to understand that substance use disorders, it's a mental illness, right? And it has to be treated as an illness, a disease that individuals are suffering from, right? So that we can truly treat it with the level of care and urgency that we treat other public health, epidemics, right? Issues of impacting the public health sector, heart disease, cancer, right? These are all diseases that we, treat with levels of care and urgency. Why aren't we doing the same for substance use disorder? So education, changing societal perceptions about individuals with substance use disorders, and allowing individuals with lived experiences to be fully part of the care continuum, not just in the community, but within inpatient care settings like skilled nursing facilities.
That's great points. And before, Sheriff, you speak, I maybe alter the question a little bit, because it would be such a missed opportunity, right, if we didn't shine a specific light on its impact on youth. And I think, Miata kind of, broached it a little bit in her answer. Like, how should we be thinking about our kids when it comes to this crisis, and the tools that we sort of use to educate, to prevent, to treat our children who have clearly seen an uptick in mental health issues and anxiety and depression, suicide ideation. If you could just speak to how do we think about our kids when it comes to this crisis?
So, this idea of stigma in our children is so intertwined. And, I a lot of times I'll speak publicly in any crowd, right? Elderly crowd, wealthy crowd, less wealthy, people of color, whatever, educated, less, it doesn't matter. I'll ask the same three questions. I do this all the time because I'm always curious, and the results are always almost the same. How many people know someone that struggled with mental health? Raise your hand if you're comfortable, right? 2/3 to 3/4, every crowd, sometimes higher if it's in the right, if we're dealing with Marlboro Hills, it's like 100%, right? Everyone there knows someone, right? How many people know someone that has struggled with addiction? 2/3 to 3/4 and more. And then I asked the last question, how many people know someone that has been incarcerated, right? It's always the same number. And to me, that shows it's not those people anymore. There are people. And so I'm still amazed that there's still this stigma issue. And by the way, I'm really appreciative of early generations 20 years ago. I don't know if you guys remember, but the very first people that would get up on that altar, speaking of their child's death, and say, my son, my daughter was an addict. Wow, it gives me goosebumps just thinking about that, right? Because everyone was ashamed to say it. Funeral directors all knew it, but no one would say it. And then people would say, I will not let my son's or daughter's life, be meaningless. I want there to be meaning. So people like Joanne Peterson got up and started fighting and saying, I will not be shamed by this. That's really remarkable that they were able to do that. And I think it's really important when you think about the children. How many families have dropped their kid off like I did just today, and then in a few years, who knows how lives can turn? I mean, So many of the kids are kids just like mine and ours. So this is something we all have to realize, and that we have to watch out for those children, especially for those adults that are at risk. We have to watch for their children. You know, we started a program in the jail to support the families of the incarcerated individuals in our custody and care, because we were always watching out for those that were in our custody and care. We're doing well by them. Sometimes, not nearly enough, we remember the victims of the original crime, but we never really even do that. But no one ever thought about the families of the incarcerated individuals. So we started up a unit. I couldn't find a like unit around the country, so we actually created one. Now we're actually having the Department of Justice is coming down to check it out. We've had thousands of contacts, thousands of visits, dozens and dozens of education sessions for family members about what medication-assisted treatment is. We prepare the individual in custody for reentry into a family with the family issues, but also medication-assisted treatment, all that stuff. But we don't tell the family what's going on. We don't prepare them on how to deal with that loved one. This unit is really remarkable. I call it trickle-down corrections. And this goes for anyone that's struggling with mental health or substance use. The children of these folks are much more likely to have those same issues. With those in corrections, it starts with, the children, truancy, failures in education, so high rates of sociopathic behavior and higher rates of incarceration. So I just believe that if we can actually reach down to that youth that are now struggling more than ever, especially post-COVID, the mental health rates, the suicide rates. Matter of fact, at this college that my son just got dropped in, there was a child from Essex County that had just enrolled, was just about to come to campus on a day like today, that suicided, right? And they sent out, God, it makes me emotional, an email to everyone on the campus, even though they didn't know this young man, to tell them. And I thought that was remarkable because he was part of the community, even if he didn't start yet. But most importantly, it alerts people to what's going on and reduces the stigma so people can understand, I might need help. I might know someone that needs help. I need to help direct them to where they can get that help that they need. So it's really important to remember this next generation that is struggling in a much more, in much worse than any generations before this. We have to be very careful and be very watchful for these folks, especially at this time.
Yeah. No, thank you for sharing that story. I think it sort of hits home what we've been discussing this morning. And you started the conversation with statistics and the 160,000 in 2021. But when you hear one story, it sort of stops you in your tracks. And it's the reason why we have to do better. Dr. Bagley and Miata, this one is for you. I've been working to maintain telehealth access for opioid use disorder treatment. And Dr. Bagley, you mentioned this in your intro. In November, the Drug Enforcement Agency is set to release a permanent rule on telehealth flexibility to treat opioid use disorders. I'm hoping you can both speak to how telehealth has helped reduce barriers to treatment and what role it plays in your own practice.
Sure, I'm happy to, and if it's okay, can I say one additional thing about youth?
Yes.
Just because
please.
I sort of can't help myself when we're trying to, but I think just sort of thinking about just to sort of add what's been said is just that, overdose is actually a leading cause of death among children in the United States, like in adolescence. And many of those youth don't necessarily have a use disorder. So it's different. So the things that as we're sort of on, it's Overdose Awareness Day, the things that put a child at risk for having an overdose are different than what puts an adult at risk. And it may be a youth who is, it may be because they're in a social situation. It might be because they have underlying depression or anxiety and they use a counterfeit pill that is all fentanyl, is contaminated with fentanyl. And that's actually the thing that causes them to have a fatal or non-fatal overdose. And so that's different. So I think as we think about youth, sort of reframing what overdose education prevention means for them and sort of ensuring that all youth have access to overdose education and learn about how to recognize and respond to an overdose in case it happens to one of their friends or to one of their family members is really important. There's no other kind of injury that happens to youth that we don't talk to them about and try to prepare them and their families for. And so it's really like a missed opportunity to not do that in a more standardized way. We can always still say the safest thing to do is not to use. And so they don't, it's sort of not mutually, it's not just because you talk to them about sort of harm reduction and talk about naloxone and talk about how to stay safe does not mean that part of that conversation is the safest thing for you, for your friends, is to not use. And if you do, this is what it can look like. And I think we're not having enough of those conversations. A lot of those kids nationally are dying at home. And so anyway, so I think that's something that we need to sort of a youth focused thinking about overdose prevention is there's some differences as compared to adults.
And it's markedly different from how we talked to youth, a decade ago. Thank you for flagging that and making that discussable.
And then, in terms of the telehealth, it's been a total game changer. I mean, it's been amazing to be able to I think it's something we all wanted to be able to do and have more flexibility, but sort of during the pandemic, and then now sort of after at least the height of the pandemic, being able to offer telehealth and have more flexibility for our patients. In our program, we still are seeing a lot of our patients in person, and there is such value in being able to sit with a patient and sort of something that there's some magic that can happen sometimes when you're really sitting in a room with a patient and a family that I have had a hard time sort of reproducing over the phone or over a video visit. And it's definitely better to have a video or a phone visit and be able to continue to engage. And so that it's really made a difference in terms of engagement. I think patients also they then perceive we are so committed. We will sort of see you however we can see you and with what works for you on your terms. And so that level of flexibility, I think, has really been critical, and we really desperately need it to continue.
Yeah. Thank you for that. Niata.
Yes, absolutely. So for us, the reality is that the traditional nursing facility is not a substance use disorder treatment facility, right? We are getting individuals who need our level of care, nursing facility level of care, and other non-substance use rehabilitative care needs. So individuals with a substance use co-occurring disorders still need that continuum of care, right? So having telehealth services in place in our setting is so vitally important to making sure that that individual substance use disorder treatment continues. And for us, the benefit has been increased privacy, whereby the patient doesn't have to leave the skilled nursing facility to go to a clinic, right? Because there's still stigma associated with that, right? So it reduces that stigma by allowing them that privacy. And I mentioned that it allows for that continuum of care for that patient, so that there's no break, right, in their substance use disorder treatment and services. And for us in the long-term care setting, we continue to face the challenge of transportation for any type of outpatient services. It's still a challenge for us. I know the state of Massachusetts has some systems in place to kind of mitigate that, but we're still facing the issue of transportation for any type of outpatient services. So having telehealth services for substance use disorders, substance use disorder treatment has reduced that problem of transportation for outpatient services. So those are the benefits that we're seeing in our setting.
It just makes sense, right? There's simply no question that we could keep this conversation going for hours, but I want to be respectful of your schedules, and of your family, Sheriff Katusian. You've been so generous to carve out time from your busy days to join us for this really important discussion. I just want to say thank you, not just for joining us today, but for everything you're doing to address the addiction crisis here in Massachusetts. I know I speak for everyone tuning in right now when I say how much we appreciate your expertise, the work that you do, and just sharing that with us in in this venue. Of course, I want to thank everyone for tuning in to learn more about this truly life or death issue and get a glimpse into some of the efforts that are happening here in Massachusetts to get individuals suffering from addiction the help that they need. If you have any questions about what we touched on during this discussion or would like to learn more, please don't hesitate to drop a comment in the chat so that we can get back to you. The addiction crisis is a devastating issue that's touched the lives of far too many families across our country. But I am more hopeful than ever, knowing that we have such thoughtful and hardworking partners in this work. And I look forward to keeping all of you updated on what we're working on in Congress and here locally to tackle this issue. So thank you all again for joining us, and have a nice long weekend.
Thank you.
Thank you.
Thank you.